Patient isn't completely blameless in this scenario. 80% of the cost in healthcare isn't greedy drug companies. It's not greedy doctors. In fact, they're just as much of a victim as the patients are. It's self-inflicted, in many cases, chronic disease, or what we call lifestyle disease.
When we look at healthcare currently, the greatest drivers of cost are a range of chronic medical conditions that are largely preventable. In essence, if we do not address the burden of disease from a preventable disease set, we will run into increasingly expensive problems within healthcare.
We are the worst country in the world. We spend more money on healthcare, but we're the most unhealthy society that there is because we've not been holding anyone personally accountable for their healthcare.
Think about that. We can reduce healthcare costs by 80% by getting people to a healthy state. That virtually all chronic disease is almost exclusively weight, but there are other lifestyle disease. We're eating our way, we're drinking our way, we're smoking our way, and we're setting our way into chronic disease.
Instead of saying to someone, listen, you're 40 pounds overweight. Can I give you a drug to treat your non-insulin dependent diabetes? Absolutely, and I might have to, as a bridge to get you back to that place where you can reset your thermostat, reset your homeostasis, and actually get to a place of health and well-being.
The temptation is to add more doctors, to add more hospital systems, to add more beds to hospitals. But this will never work in the long term. There is an endless amount of money we can put into the resources of healthcare, but without fixing the preventable chronic conditions that we see, that we know that are preventable, we will never be able to fix healthcare.
In order for healthcare to heal, I think physicians need to heal themselves and recognize that nutrition and exercise and a spiritual practice and some aspect of figuring out who they are inside, why they went into healthcare. To me, healthcare it's an art. There's the art and the science. And we've gotten so far to the side of the science in healthcare that we forget the healing art.
When you take a look at the epidemiology of chronic disease is really the biggest disease of our time, and it has to be eradicated in order for us to make healthcare affordable.